in light of recent events, I thought it would be a really great idea, since we're all stuck at home alone from one another, that it would be nice to do a virtual Kinstretch class. So today, we're gonna focus on the hips. And I'm gonna assume that everyone has done their CARs routine prior to this, but if you haven't, we're gonna start off with our hip CARs. What a CAR is a controlled articular rotation. Essentially, all we're trying to do is make the widest range of motion we can with our hips. So all you'll need for today's class, a ball or some type of a ball, and then a yoga block. Now, if you don't have a yoga block, you can use a foam roller, you can use a pillow, you can use any kind of object that you can find. We'll go through what you're gonna use this together. But how we're gonna start is we're gonna start off on our hands and our knees. We're gonna take that ball, we're gonna put that ball behind our right leg. Now, if you wanna grab that yoga block or foam roller or something like that to put on your back, it can just give you some external feedback as far as if we're rotating through our pelvis rather than through our hip. So first thing we're gonna do is we're gonna squeeze that heel towards our butt. We're gonna bring our hip back into extension as far as we can until we feel like we have to arch our back to get any more range of motion. You're gonna rotate that outside of the knee up towards the ceiling. You're gonna maintain that knee height without rounding that back as you pull up towards your elbow and down. We're gonna do 2 more of these nice and slow following my pace. Bring that heel back, hip into extension, rotating outside of the knee up towards the ceiling, maintaining that knee height, not rounding that back, pulling up towards your elbow and down. 1 more time, nice slow control, bringing it back, rotating outside of the knee up towards your ceiling, maintaining that knee height, pulling up towards the elbow and down. We're gonna reverse that movement. So knees going to the elbow first, rotating out, again, not rotating from the pelvis, but from the hip, bringing it all the way back into extension, and down. 1 more time, up towards the elbow, swinging it out, around, back, down. Last time, slow control, just moving from the hip, not moving from that lower back or that pelvis. Switch sides. So again, putting that yoga block on our back, putting that ball behind our knee. What that's doing is that's maintaining that hamstring activation as we go through this range of motion. We're gonna go backwards first, so pulling our heel to our butt, driving that hip back into extension, hitting that roadblock, rotating outside of the knee up towards that ceiling, trying to pull up towards the elbow and down. Again, hip back into extension, rotating outside of the knee up towards that ceiling, trying to maintain that knee height, pulling up towards the elbow and down. Last time, hip into extension, rotating out, pulling up towards the elbow and down. We're gonna reverse that movement, pulling up towards the elbow, swinging out, around and back, coming down again up towards the elbow, bringing that leg out. Make sure you don't cheat yourself. Come all the way back before you bring it down. The low back shouldn't move at all. 1 more up towards the elbow, swinging it out, around, and down. Next thing we're gonna do is we're gonna lay on our side. We're gonna work that hip capsule through external and internal rotation. So I'm using my yoga block as a pillow. You're gonna be laying on one side. You're gonna have your hips stacked on top of each other and your knees stacked on top of each other. So, if you wanna take another foam roller object or pillow or something to put it behind your pelvis, that'll help. If we rotate out through that pelvis, that object will fall. So from this position, remember knees stacked, hips stacked, shoulders stacked, we're gonna pull our knees as far apart from each other as we can. Now, keeping this knee exactly where it is, we're gonna start with that ankle and we're gonna rotate our ankle, trying to pull that ankle up towards our face. We'll feel that in the hip. We're holding for 5 count. Then we're gonna bring that ankle in as much as we can. Again, not moving that knee at all, holding for a 5 count. We're gonna do 3 more of these. Pull those knees even further apart. Ankle towards that face, holding 3, 2, 1, reverse, pulling that ankle in, not moving that knee, holding for 5, 4, 3, 2, 1, reverse, 2 more, pulling that ankle, 5, 4, 3, 2, 1, reverse, pulling that ankle in, 5, 4, 3, 2, 1, last one, make this one your best one yet, drive that bottom knee into the ground, pull that ankle towards your face, 5, 4, 3, 2, 1, reverse, last one, 5, 4, 3, 2, 1, relax. We're gonna switch sides. Again, if you feel yourself cramping or right on the verge of cramping, what that is that's neurological confusion. So it's your brain telling your body that it doesn't know what to do in this position. That's just because we've never trained this position before. So work right up towards that cramping. If you do cramp, try and fight through it. If you need to shake out, you totally can, but then hop right back in. So again, knees are stacked on top of each other, hips are stacked on top of each other, shoulders are stacked. We have some type of object behind our butt preventing us from rotating out through that pelvis. We're gonna pull those knees as far apart as we can, feeling that tension in that top hip. Without moving that knee, we're gonna take our ankle, pull our ankle up towards our face. Again, don't arch that low back, keep that low back nice and still, all coming from the hip. Pull in 2 more seconds. 1, relax, we're gonna reverse that. Ankle's gonna try and pull down towards the ground hard as we can. 5, 4, 3, 2, 1. We're gonna reverse that. Again, ankle pulls up. 5, 4, 3, 2, 1. Reverse, keep pulling those knees apart. 5, 4, 3, 2, 1. Reverse, drive that bottom knee into the ground. Don't arch this back, pull that ankle, feeling it in that hip. 3 more seconds. 2, 1. Reverse. 5, 4, 3, 2, 1. Last one. 5, 4, 3, 2, 1. Reverse. 5, 4, 3, 2, 1. Relax. Now, from this position, go ahead and grab that yoga block or that foam roller, any object that you can find. It could be a book, a couple books. Now, what we're gonna do is we're gonna isolate internal rotation on this top leg. So how we're gonna do that is we're gonna use this object to squeeze our knees into. As we maintain that pressure on our knees, we're gonna pull that ankle up as high as we can towards that sky. Again, you should feel all that tension right through that top of the hip. We're not gonna dump that pelvis or anything like that. Maxing out our end range, holding 5, 4, 3, 2, 1. Relax. We're gonna do 3 more of these. Squeeze that yoga block and pull. 5, 4, 3, 2, 1. Relax. If you want to take that top hand, put it right on that pelvis. You're going to feel that femur or that leg bone rotate in that capsule. Pulling at 5, 4. That's what we want to feel. 3, 2, 1. Relax. Last one. Squeeze that yoga block and hold. 5, 4, 3, 2, 1. Relax. We're going to reverse that. So opposite side. Again, same position. Hips are stacked, knees are stacked. Bringing that object, squeezing your knees together. Knees are going to be at about really you can just kind of vary it yourself between 45 to about 60 degrees. Squeezing those knees together, pulling that ankle up, holding 5, 4, 3, 2, 1. Relax. 3 more. Squeeze that block. Hold. Find that end range. 5, 4, 3, 2, 1. Relax. 2 more. Squeeze that block. 5, 4, 3, 2, 1. Relax. Make this one your best one yet. Squeeze that block. 5, 4, 3, 2, 1, and slowly relax. Next thing we're gonna do is we're gonna hop into our 90-90. Now, if you've never had the pleasure of experiencing this position before, without further ado. So, what this position requires is we wanna get to where one leg, let's go left leg first. So, our left leg is gonna make 90 degrees, our right leg is gonna make 90 degrees. Our right thigh is gonna be parallel with our left shin. Left thigh is gonna be parallel with that right shin. Now, if you feel like you can't stand it or sit up nice and tall in this position, you feel like you're gonna fall over, use that left hand as a kickstand. If you need to, grab that yoga block or that object to assist you into this position, by all means. This is not an ab exercise, this is a hip exercise, so I don't want you focusing on trying to hold yourself into that position. What I want you to focus on is feeling that in the hips. So today we're gonna focus on the front leg and the front hip, and what this requires is external rotation. What you might be noticing is if you get into this position and your knee is way the heck far away from the wall, or from the ground, that tells you we have a lot of work to do on our external rotation. So from this position, first thing we're gonna do is we're gonna arch our back, we're gonna get our chest nice and high. We're gonna use our hands to walk ourselves forward until we feel a good stretch through that hip capsule. I don't wanna see us rounding at the spine to try and get a superficial stretch. If we arch our back chest high, imagine our belly button gliding forward, you should be able to find a good stretch without having to go too far. Now from this position, we're gonna first work on isometrics. What an isometric is essentially we're engaging the muscles as hard as we possibly can without actually moving that joint. So from this position, once we find that good stretch, again, chest nice and high, back arched, we're gonna take our ankle and we're gonna imagine that there's a weight scale underneath our ankle. And we're gonna try and press that pressure into that weight scale, and we're gonna ramp up. So we're gonna start nice and light. We're gonna take that ankle, we're gonna drive that ankle down into the ground at like 5% effort. Nice and light, feel that glute kick on. 10%, 15%, feeling a little bit more tension through that front leg. 20% hold there. 5, 4, 3, 2, 1, and slowly relax. Sink a little bit deeper into that stretch. We're gonna go a little bit more intense with this contraction. We're gonna start off at about 10%, pressing that ankle down into that weight scale. 20%. Now, if I walked up to you and tried to lift this front leg off the ground, I wouldn't be able to. 30%. You should feel a difference every step of the way that we go. 40%. Good. Things might start to shake. 50%. Good. Making sure this isn't painful. If this is painful, back off the contraction. 60%, things are shaking, starting to get a little bit hard. Take that back leg as well. Drive that back leg into the ground. Hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and slowly relax. From this position, we're gonna get into the opposite 90-90. So we're gonna make this leg forward, but instead of just doing it passively, we're gonna do it actively. So from this position, what you're gonna do is you're gonna take your left knee. You're gonna drive your left knee to the ground. Your left knee is pinned to the ground. As we pin that left knee to the ground, we're gonna swivel on that right ankle, pulling that right knee off the ground. We're gonna continue to pull these knees apart as far as we possibly can until we feel like if we can't go any further without bringing this knee off the ground. Bring that knee off the ground, but still pull those knees as far apart as you can, continuing to pull. If you need to use your hands behind you, you can. Continuing to pull, continuing to pull, continuing to pull until you find yourself in that opposite 90-90. Now, reassess. Again, front right thigh should be parallel with that left shin. Left thigh should be parallel with that left right shin. Now from this position, using your hand as a kickstand, we're gonna arch our back, chest nice and high, and we're just gonna walk ourselves forward until we feel a good stretch through that hip. As we breathe into the stretch, first thing we're gonna do, nice light contraction. nice isometric. What this is a PALS contraction, progressive angular isometric loading. There isn't a test at the end of this, but essentially what that means is we're engaging the tissue that we're stretching. And that's how we gain more range of motion through this position. Now, we're gonna start nice and light, imagining that weight scale underneath our right ankle, driving down at 5%, 10%, 15, 20, hold 5, 4, 3, 2, 1. Slowly relax, sink a little bit deeper into that stretch, walk yourself forward, still keeping that chest nice and high, back arched. Second round, we're gonna get a little bit more intense. So still imagining that weight scale is underneath our ankle, driving down at 10%, 20%. Again, we should feel a change in our tissues every step we go. 30%, 40, things might get a little shaky. 50%, again, we don't want this to be painful. If this is painful, back off. 60% hold there. I shouldn't be able to lift your foot up off the ground. Keep pushing, 7 more seconds. 6, 5, 4, 3, 2, 1. Slowly relax, but stay in that position. A couple breaths into this position. Now we're gonna finish off today with a little bit of a challenge. So we're gonna go back and forth into that opposite 90-90. So we're gonna put everything we worked through today together. So again, from this position, we're gonna do 4 of these together. I urge you to stay at my pace, don't go quicker. Again, the slower you go, the more control you have of this movement. So you're gonna take your right knee, drive that right knee into that ground, swivel on that left ankle, pull that left knee, pull, pull, pull until you feel like you can't go any further. Continue to pull as you transfer your weight onto that other side. Keep pulling those legs, keep pulling those legs, keep pulling those legs, and slowly relax. Again, if you need to use your hands behind you, you can. Challenge yourself, if you can, to not use your hands. We have 3 more. Drive this left knee into that ground, swivel on that right ankle, pulling those knees apart, pull, 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 keep pulling as you transfer your weight, pull, 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 and slowly relax. Reset that 90-90, make sure we're in a good position. 2 more, make these 2 your best. Drive that right knee into that ground, pin that right knee, swivel on that ankle, pull those knees apart as much as you can. Continue to pull, continue to pull, continue to pull. As you transfer your weight, you're still pulling those knees apart, still pulling, still pulling, still pulling, still pulling, gently setting it down. Last one, make this one your best one yet. Challenge yourself even more. Drive that left knee into that ground, swivel on that right knee, pull that right knee apart, pull, 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 keep pulling, keep pulling. Slowly transfer that weight, keep pulling, keep pulling, keep pulling, keep pulling. Work till the end, work till the end. Pull, 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 and gently set down. Thank you guys so much for following along with me. As we go through this, who knows how long we're gonna be doing this, but my hope is to at least give you guys some type of mobility training that you can stay consistent with until we can all actually hang out together again. So thank you guys all so much for watching.